Okay, so we'll go ahead. I will take first, huh? During exam, I'm damn sure, huh? I'm warning you, giving warning, huh? Even I was really confused when the heart was flipped. Because when the heart will be flipped, means it will cut like this and it will be flipped like this. And the specimen will tag on the opposite side. You will confuse. You will write that one is left sided, but it is not left sided. You have to see that it is the mirror side. So this one is right, so it will be right like that. I'm definitely sure that be careful during exam, huh? I'm telling you. Okay. So here we have three specimen that we tag. This one here, the green one is your posterior, anterior. Yellow one is anterior, and the red one is septal, like this. This one is heart. If I cover like this, it is the anatomical position. So anatomical position, this one is your ventricle, right sided, clear. You opening the wall. If you opening the wall, that this one is anterior, right? Anterior wall. So if the cusp is attached with that wall, then what will be anterior cusp? So this one is attaching to the anterior, so this one will be anterior. Okay. Now this one, see here, this one is literally, you can see here at the posterior side, it is going to your posterior septum. Okay, posterior septum. So this one is your posterior cusp. So during exam, doctor will ask what structure is that. You have to write the proper name. Posterior cusp of the tricuspid valve, like that. Don't worry about the, during when you are mentioning the valve, tricuspid or bicuspid, you not need to worry about the laterality, right or left, because of course definitely people knows that right side have tricuspid and left side have bicuspid or mitral valve. Okay, so during that time you just have to mention the anterior cusp of the tricuspid, posterior cusp of the tricuspid, or the septal cusp of tricuspid. At the left side you can find the two cusp. One here, this one is anterior border, huh? See, I told you, if you will flip, it will be totally different. So when you will flip, then this one is your anterior cusp, and here is your posterior cusp. So there are two cusp in the left side, anterior and the posterior cusp. Okay, so these three that you have to, did you remember this one, Naha? Clear? This all stuff. Now main thing you have to remember is chordae tendineae, because chordae tendineae will be tagged by the doctor. So if doctor will tag this tendon type, see, it is very small fiber type. So this tendon is your chordae tendineae. Spelling, I cannot heard the all voice together. Chordae tendineae. Okay, so since you guys having trouble for it, so assignment for everyone, not for only you guys. Assignment for the whole ASC. Next Saturday, you have to pass all names that I will highlight tonight and I will share in the group. I want 10 times you have to write down and you have to give it to me. I don't know when is your lab exam, but I want that so you will be perfect in your spelling. Okay? So assignment for all of you that I will share tonight. Okay? Now, you can see here this all structure. This chordae tendineae, this small fiber chordae tendineae. chordae tendineae. It's attaching with this muscle, and that is your papillary muscles. Now you have to identify which papillary muscle is that. Anterior, posterior, septal, anything they will ask. Okay, so since this is attaching to the septal and the posterior cusp, so this one is your posterior. Okay, posterior, and the septal will attach with the anterior cusp and septal cusp. Always remember, this combination will come out in your written exam. This combination will come out in your written exam, maybe on this coming Monday. I'm sorry, I forgot to inform in your class, but someone just chat their hand and just make that thing there in our chat group, so they will not forget it. This one will come out in your exam. The anterior will be from the posterior and anterior, and the posterior will be from posterior and septal, like that. So you have to remember that way, how which tendon will attach with the which papillary muscle, because not only what if something will happen, why there is a two-sided chordae tendineae attached with the one-sided wall, because in case something will happen with the one papillary muscle, second papillary muscle will work and pull the cusp down. So I know that it will not work 100%, at least it will work at the 70%, like that. Okay, so that's why there is our body is always like compensate something and something. Okay, especially those who have a heart problem, those who have a hypertension, and also had a rheumatic fever. Rheumatic fever is also one type of the thing can cause the mitral valve stenosis and aortic stenosis, and it is really rampant. Have to be careful with that. Okay, now after the all cusp, you identify chordae tendineae, you identify in chordae tendineae, you just have to mention the chordae tendineae. No need to mention the anterior, posterior, or lateral, or whatever. Okay, just chordae tendineae, nothing else. But when you are going with the papillary muscle, you have to mention that what side of the papillary muscle is that, anterior, posterior, or septal, and or maybe you can find that the left side, that this one is your anterior. This one is not deep dissection, this one is superficial dissection. So you have to when you are looking at the specimen, you have to measure out that how deep dissection they did, because somehow this one is anterior papillary muscle and the posterior papillary muscle is here. See, this one is posterior papillary muscle. Okay, this one is posterior papillary muscle, this one is your anterior papillary muscle. So that's why what will happen, this one and this one, two are the anterior papillary muscle, and the posterior side is posterior papillary muscle. Now, one more question I remember for your assessment coming Monday is, which papillary muscle is the largest and the big? Anterior. Always remember that question, always come out in the exam.
Anterior papillary muscle, tricuspid or bicuspid?
Anterior papillary muscle in the tricuspid and also in the bicuspid, because anterior and the posterior valve both of side. The thing only add in the right side is the septal. So septal is the smallest. Which papillary muscle is really smallest is your septal, because septal muscle are literally very small, or maybe there is no appearance anymore, like that. Okay, now papillary muscle we are done. Our trabeculi carneae muscle. Okay, so trabeculi carneae muscle is this one. Okay, the trabeculi carneae muscle. That all muscle that you have to remember. Don't mix that all thing with the papillary muscle, because papillary muscle you will mix with. But if you really want to identify the papillary muscle and your Trabeculae carneae muscle, always look for the chordae tendineae. If chordae tendineae is there, that means it is papillary muscle. Got it? Okay. Now, doctor will, one more question doctor will tag here is this one. It is most common. Interventricular septum muscular part. You have to mention it is muscular part because this one is here is membranous part. Because during our time it was mentioned this one and it was the membranous part.
It's really membrane.
Yeah, it is like it will be not like muscular is like fiber, see, muscle type. It's very, but you cannot find muscle here. There is no muscle here anymore. So that is your membranous part. I think it is already here.
How do we name it?
Interventricular septum, membranous part. Membranous part of the interventricular.
Ah,
septum.
yeah, this one.
Did you got it now?
Yes.
She found already. Okay. Now, most important thing for your right atrium, sulcus terminalis, and there is one more name, sulcus crista terminalis. Okay, sulcus terminalis and crista terminalis. Can I have that for a while, huh? Because I confused. Crista is, I think, sulcus is outside. Crista is inside. Now, when you are doing this kind of what we call like this, see this blue marking here, and it is like a outer side groove. This blue marking. This blue marking here. This blue marking, huh? This marking is outer side. There is a inside also. So it is named like sulcus terminalis and sulcus crista terminalis. Crista terminalis is inside the sulcus. Sulcus always found at the outer side. The bulging or impression part you can call sulcus. Okay. So this one is your sulcus terminalis. But most probably doctor will ask about the crista terminalis. This one. This one, the band here, you can see this band. This band you can see here, the yellow pin that I tagged is your crista terminalis. Okay, this crista terminalis, you have to remember this one. Because, and the smooth part of that that you have to remember, it is your sinus venerum. Because this thing was also came out in our exam, during our exam. It is your sinus venerum. The rough part is your pectinate muscle. Okay, this one is pectinate muscle. So if doctor will tag this one is, it will be your
Pectinate
muscle, and this one is your
crista
crista terminalis. Remember crista terminalis. Then this one is your sinus venerum. Okay. Now here, this is the opening. Inferior vena cava. Opening of inferior vena cava. Wherever there is an inferior vena cava opening, there is supposed to be here one opening. It is cut already. That opening is for coronary sinus. If I can find here. Here, see here. This opening here. This one is inferior vena cava. Beside that there is coronary sinus. Opening of coronary sinus. Remember this one. Opening of coronary sinus. Okay? Coronary sinus. Now, one more thing I really want to tell you is about, that is the thing only for the heart, the valve. Yeah, if you will open this valve, you want me to see here, you can find the semilunar valve here in the inside. You can find the semilunar valve inside. There is. Okay,
Show it this way, doc.
Uh, here inside
Oh, okay.
semilunar valve, it will open and close. Actually, there is one specimen, it is cut with the valve is open, so have to identify if there is a aorta. Okay, if there is aorta, then there is no, which cusp will you cannot find there. Anterior. Open it, so you will here this one. So this one is your aortic valve, right? So one part you can see is here, here, this one. Aortic valve, you can find the right, left, and posterior. But in pulmonary, you cannot find what? Posterior. So always remember, when the doc will cut it, open it, and the flip it, then you have to identify this structure, lenule and also the cusp. Okay, so you have to identify about the valve, and it is like what we call this structure, lenula, and the pigmented point is your nodule of the semilunar valve. So nodule and lenule you should know. During our exam, we didn't prepare for that. Suddenly it's appear, and it was the tag nodule and lenule. I really remember that I wrote the lenule aside of the nodule. It was tagged the nodule. I never forget those things. I made a mistake. So be careful with that. And also the opening of the coronary arteries. Remember, wherever the coronary artery is opening, definitely there is a right and left what we call cusp, but the remaining one will be your posterior cusp. Okay, in the aorta. Remember that. The posterior and the right and the left. So always remember, when the heart is up front of you like this one is left side. Even your right side hand is like this. Okay, at the right side, you look at the right side, but this one is your left side because it is your opposite side. Okay, now if the aorta is open in front of you, then which side of the opening will be your left coronary artery? This side, at your right side, since the heart is up front of you. Okay, and this one is the right sided. So what will be for the coronary artery? So right sided coronary artery will be there. The opening, always remember during exam, in assessment, that is also important, that which cusp, after which cusp you can find the right side and the left side coronary artery opening, like that. And the first branch, always don't forget, always the first branch of the aorta is your coronary arteries, not any other arteries, not even the major arteries of the head and neck and the upper extremities. Okay, so first branch will be your coronary arteries. Did you remember all these things that what I said? Okay, this is the stuff that will be asked by the doctor during your exam. I don't know who tagged like this way, but this one superior, this one is inferior pulmonary artery. Actually, this is cut between, like deep cut, so that's why both are together.
The heart is very shrunk, no? So small.
It's very small, so I think it is kid. Okay, it is kid. Yeah, one more thing I have to tell you is your fossa ovale. That will come out during your exam. You can find the fossa ovale here, which will give you the what we call which is the opening between, yes, and it is normal or abnormal?
Normal in adults.
In fetal is a nurse.
Fetus normal, adult abnormal. It's supposed to be close. How it will close, you will see in your physiology. Actually, this one, it is close already. Here, this one is fossa ovale actually. Okay, here, this one is your fossa ovale. It will close after the birth. Due to the pressure, blood pressure, actually secondum and also ovale, it will close by the secondum, foramen secundum. Primary opening and then secondary opening. It will from superior to inferior, inferior to superior, and then goes like that. You will learn about that in your physiology. Okay, later on, then you will have idea. Of course, blue boxes during your exam, don't forget it, because in there is mentioned the ASD, VSD tetralogy of Fallot, coarctation of aorta, and also there are few diseases given there. It is really important. Until right now, I am studying that in all subjects. So you can imagine how important is that. Maybe doctor will ask the question regarding that. Today question paper was not settled by me. If my question was settled there, I don't think that anyone can answer. Because I really want to give the hard question this exam, but I was quite busy with my study stuff. Especially I have OB-GYN right now, so I have less time. But as my OB-GYN will finish, then I will start giving lecture in ASC regularly. Until that time, other people will take over. So the hard thing is done about the structure from the outer side and you're inside the structure. Okay, that is the thing you have to mention during. Can anyone open the cadaver? So if I can find the structure of the great vessels of the carotid arteries and the stuff, then I will identify, because I hope the heart is really preserved there. I'm not sure though. Let's see in the cadaver so I can
It
identify.
came out in our assessments, now moving exam.
Last moving exam.
Subclavian.
Subclavian. Yeah, I really heard. One thing I really heard about that. Actually, last time someone asked, you asked, right? I identified their room, that room. Yeah. Actually, last time I identified vasculature to her for the neck, but I was not aware that they will ask for the neck, so I just closed the cadaver. I hope she can able to answer.
You answer?
I answered.
Actually, that is really easy. If you will, once you will see that, I will explain. You will really identify very easily. Especially inside, you have to find the carotid sheath. In carotid sheath, 3 things you can identify: common carotid artery, internal jugular vein, and the vagus nerve. So this, if you really want to identify the carotid artery, you have to find for the carotid sheath. If you will find the carotid sheath, open the carotid sheath, you will find the 3 structure, vagus nerve. First you will find is your jugular nerve. Jugular vein, internal jugular vein, common carotid artery, and between both of them you can find the vagus nerve, like that. It is both of sides. I will try to identify in that manner. Okay, just open the